people with vein stripping. And we saw so many women with vein issues. I've now taken care of, in my career, over 1,000 patients with vein disease. Because it's really a new technology, I've only taken care of 9 patients who are men. So they're almost all women. And it's usually because of, men usually don't get pregnant in my practice. So people in this room that have some vein issues, because it affects almost 1/10 of the American population. So we typically see patients with vein disease like this, then they're going to get changes of their skin. The skin color changes because of deposition of the blood components like bilirubin into the skin itself, which progresses to actually terrible ulcerations that we'll see. Usually on the ankle side, usually medial on the inside, sometimes on the outside, or on the front surface. So that's typically what we're seeing. So here we're talking about our population in this country is just over 300 million people, and yet one-tenth of our population is affected. In this room, though, most of the women will have some type of venous disease. It's a very familial disease. If your mom had it, there's a good chance that you're going to have it as well. So vein disease affects more people in our country than most of the issues that affect our country. Heart disease is still the #1 killer. Cancer is close behind. Stroke is right behind that. So as you can see, as our population ages, our vein issues become worse. And it becomes worse because we have valves in our vein. It's a low pressure system. Those valves over time break down. And when they break down, the vein below that area begins to dilate up. And then that valve right below that breaks down. And then the vein dilates up even more. And it's just a terrible problem that worsens as we get older. So in the 20s, most people don't have it. This is usually familial, where people will have inherited it. But we've taken care of 20-year-olds, even teenagers with vein issues. You can see that men are about half affected as women. The vein system is a low-pressure system. The heart pumps blood to the body. That's the artery system. In the capillaries, we give off oxygen to our body. The blood takes up carbon dioxide. And then the veins are a low-pressure system, and that's why we have valves. The valves help get the blood flow back to our legs. Back from our legs to the heart. Also, just by walking alone, your calf will act like a pump and help get the blood flow back to the heart. And so I touched upon this a little bit. We have valves in our veins. As those valves begin to dilate up as we get older, and this happens to everybody, they become incompetent, and letting blood flow go down to the next valve, which becomes incompetent. And then I'm sure you've seen people, or some people in this audience may have it, where the valves become so incompetent that the veins are so visible on the surface of the body. So it's gender-related, mostly women, age-related, mostly older folks as we get older. Hereditary plays a big part. Pregnancy plays a huge part. And for some reason, when women are pregnant, the uterus kind of sits on the big veins in the pelvis, and that makes the valves even worse in our legs. So women who have had more pregnancies usually have more vein problems, especially in that left leg. If you're standing, Becky and I just saw a patient today who's a phlebotomist, and so she would stand all day long, and she's got terrible vein problems that we're going to have to deal with. Obesity, as our population ages and as we become more obese, and I'm sure you've seen it as you all have gotten older, that the population seems to be getting more and more obese. And so obesity plays a big role because you've got this huge weight sitting on those veins, and that extra weight will add to the incompetency of those veins. And what happens as our veins begin to dilate, we get a lot of leg pain, especially at night. So leg pain, especially at night, not with walking, but just a heavy, aching, cramping feeling. The skin will sometimes itch, just like an old incision site or scar, just because of the bilirubin that's being deposited. The legs begin to swell. As they begin to swell, there's this heavy sensation, and people just don't want to walk around that much. And then as I showed you that photo, the skin actually changes its color. And then eventually, as the skin begins to break down from the leg swelling and all that water weight, that's what happens. You'll get these ulcerations, these venous stasis ulcers that are so difficult to heal. So in this country, 20+ million people have varicose veins. It's 1/10 of our population. And then it advances where about 500,000 people have leg ulcerations. There's 50 states, 10,000 people, let's say, per state if we were just doing it on a state-by-state basis. But you've got this huge population in between that has these skin color changes. We like to attack these folks early when just the varicoses are present so that they don't progress to the ulceration state, which could be so debilitating. And so there's graded now classifications, which you don't have to worry about, but I share this with other physicians because it's now graded, because finally people are taking a look at this terrible problem that everybody has ignored in the past. There's two types of systems out on the market right now for treating advanced vein disease. One is called the Vnus system. And this actually sends a hot wire. So the Vnus system is actually, it's a hot wire. It's a hot wire that due to radio frequency. Very simple operation, which we're going to show you how simple it is. I could teach everybody in this room how to do it. But it basically, you put a wire that you get hot by turning it on inside the vein. We do it under ultrasound guidance. You run this catheter up to the level of the groin. You turn it on. And when it turns on, it causes the veins to shrink down just by the heat alone. In the old days, they would have made multiple incisions going down your legs. And that would have just been debilitating. You're in the hospital for a long time. These folks are in the hospital literally for 2 hours. They come in, we take care of the veins. They feel better immediately. They even feel better months down the line as well, as their legs are getting better from the vein flow being distributed to the healthier veins. So you occlude one of the medium-sized veins, the blood flow gets diverted to the bigger veins, which are not affected by these issues. And so there have been many studies. It's been a very studied procedure, and the occlusion rate is very high, meaning the system works. And you could actually watch it under ultrasound while we're doing this operation. You could watch the vein closing up with ultrasound data. And you could grade what you're doing. There's another system out, which is a laser ablation type of system. I used that at first. I was not happy with it because it heats up so high. It heats up to about 400 degrees centigrade. The other system that I use now heats up to 100 degrees centigrade. When it heats up that high, it just burns. There's a huge burn. And I don't want my patients to look bad after a procedure. I want them to think, okay, this guy did a great job, and that there's no type of changes of the skin. There's no type of ecchymosis or any type of black and blue marks from blood loss. And immediately after surgery, I tell the patients, okay, get up, you're walking around. We have them wear stockings immediately after surgery and even before surgery. I don't even limit any strenuous exercise anymore. And I really want them to wear the stockings almost on a daily basis. So I tell them, brush your teeth in the morning, take a shower, whatever you're going to do, put your stockings on. I think it's so important that we do that. Everybody should do that. And so this has been studied. It's been looked at for years down the line. The studies with regard, when you compare the radio frequency, the closure fast versus the laser, is much better. Again, this you don't have to worry about. You just have to worry about, okay, is this going to work? And it does work. I'm actually going to show you a video of, it's an animation of this. Why do you think humans are the only animals in the animal kingdom with vein issues? Exactly. That is exactly right. We stood upright, and when that happened, it freed up our hands, and that's when humans' brain exploded. So we got so smart because we're able to use our hands. Most of our brain is for this one thing alone, and our vision in the back of our brain. But when we stood upright, that set forth a whole problem. And that's why even humans to this day still have issues with regard to childbirth, because we have become an upright creature. So giraffes don't have issues with it, elephants don't have issues. And it's interesting, when I see some of these advanced patients with lymphedema, it's called Elephantiasis. You may have seen some people like that. Shelley and I will go to Walmart sometimes, and you know, I used to have professors in medical school in Chicago. We would make diagnoses by riding the trains or going to the mall. And so I still go to the Walmart, for example, and I'll say, oh, okay, this patient is that, and that patient is that. But I'll sometimes see patients with terrible vein problems and almost elephantiasis, but elephants don't get this issue. But you're right. Thank you. One thing I really love about this is I love the way technology has improved my life as a surgeon, my patients' lives as patients. There are such unbelievable changes in, for example, cardiac surgery, where we're doing a lot of what's called beating heart surgery. It's so much easier on the patient's hearts when you're able to do beating heart surgery. You got it.
It doesn't have sound, does it?
No.
Okay.
All right.
There you go.
So, can you stop that a second?
Yes.
So, we sedate the patients a little bit, but we numb up the skin. We give a little bit of Diprovan or propofol, which is that drug that he was using in toxic doses. So the patients are kind of relaxed for the 15 minutes that it takes to do this. Numb it up real good. Make a little incision right there. We put a needle right through there, and we could identify the vein using ultrasound. So I could put I could put the needle right into the vein that we're trying to access. Go ahead. Then we run up this catheter right through there, and we run it up all the way to the groin. This is about a ½ inch underneath the skin, and we run it up to the groin. That's the patient's groin. And so we turn it on, and for 20 seconds, we'll heat it up to about 100 degrees centigrade. But we live at 37 degrees centigrade, so we heat it up to 100 degrees centigrade. Pull it back. That initial segment is closed off, and you just run it back about 7 to 10 centimeters every time. So about 5 inches. You take care of 5 inches at a time. Heat it up, bring it back down, heat it up. In the old days, they would have made incision, 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 incision up and down your legs. Somebody who has had vein stripping in here? Nobody? Thank you. All right, would you drop your pants so we could see? No, I'm just joking. But you saw how scarring that was. Sorry,
yes,
Shelley.
Exactly.
We're not going to have any patient demonstrations. I thought that was going to be you. But, I mean, it's so disfiguring. And it doesn't even take care of the problems. Because the vein blood flow would be rerouted just to another big vein right on the surface. And so she lived with it her whole life. And even after the vein stripping, she still had these problems.
Yes.
Right.
Yes.
And here we just do it through a little poke hole. She probably was in the hospital for a while. Now we send the patients home that morning, right after we do the surgery. Take care of the entire vein segment and pull out the catheter. So in heart surgery, we're doing a lot of beating heart surgery, which has really opened up the doors to treating a lot of patients. Here, you could turn that off. In vascular surgery, there's all these newer techniques where Dr. Hallett and I could work together on taking care of a lot of the blockages on these patients with blocked up arteries. And in the old days, everybody would have needed big operations. And now Dr. Hallett could open those up just by using a catheter. We took care of a 94-year-old fellow the other day who had a ruptured aneurysm, 94 years old. When I was down in Houston, they would have let him go at that time. And that was back in the 80s when I went through my training. We took him to the cath lab. We put a graft inside his aorta, and he went home the next day. And that's how you fix a 94-year-old fellow with a ruptured aneurysm now. The lung surgery, we are now doing more minimally invasive. We're doing a lot of scope surgery where we're able to do just poke holes on the side of the chest. And we're able to remove cancers that way. Being able to remove lung masses that way. So much easier on the patients who are sometimes so sick. And now we've got ways to treat veins instead of doing disfiguring, terrible surgery, vein stripping. I look back at my residency training, it was my least favorite thing that I did because the patients just did not improve after that. And now here's a technology, and in 10, 15 minutes, you take care of them in the operating room, they go home that day, and these are happy patients. They love not having that pain in the legs, and they feel better. So I love the way technology has improved my patients, made it so much easier on me as the surgeon. The patients could go home that day, the next day, after major surgery. I would have never dreamed of an elderly man who was trying to die right in front of my eyes, where we could just put a stent inside of his aorta, and within an hour he's fixed, and he could go home that next day. That's why I just love the way surgery has progressed to the point where it is right now. And so what I wanted to do, I'm going to leave you some information back there with Becky with regard to this vein therapy that we're doing. If you have any questions, you could ask them now. I'm also going to have some of my cards available. We're down here every Tuesday afternoon, and we're up in Lufkin for the remainder of the week. And I really appreciate you being here. Thank you very much. Thank you for your patience with me.